you're gonna approach the ribs. You're gonna stand on the opposite side of the rib that you're trying to oscillate for this one, okay? With you're gonna contact the rib like along the hypothenar, the ulnar side of your hand. Try to get a good grip along the whole rib. So if the patient's standing right there, you're gonna try to come in and just contact the rib, like with the ulnar side of your hand, right there with the pinky and everything. Okay?
Can you see that figure?
You're gonna try to be right off the transverse cross there because that's the joint you're gonna immobilize. You guys remember how many segments does the most of the ribs attach to on the right? So for this one, you're gonna try to just to broaden your stabilization area a little bit more because you're trying to get more than one vertebrae stabilized. So we're gonna stand on the opposite side of the rib that you wanna to work on. Okay. So you're gonna use for this one the hand towards their head to make the contact with the rib, and you're gonna try to contact as much of the rib as you can, not going over the transverse process. Okay. And with the caudal hand, you're just gonna go stay on the opposite side of the spinal process to stabilize the transverse process. Is that too many process to process? But you guys got that though? You're gonna stabilize on the side closest to you at the transverse processes of multiple levels, and immobilize the rib on the other side. Okay? And again, the force they're gonna provide is more a anterior lateral. Try to follow the rib angle a little bit. It's just oscillating there. Okay? Again, you're mobilizing a rib, and you can coordinate this with like breathing if you want to. You can either oscillate there, and if you really feel that the rib is like in a stuck position, meaning it doesn't move as well as on the other side, or it doesn't move as well compared to the other, then you can be a little more aggressive with oscillations, or ask the patient to inhale, and then as she exhales, you can kind of work with it, or you can hold the rib down and ask the patient to inhale as you stabilize the rib. And again, when she exhales, you can continue to work on it. Okay. For the lower ribs, that's a little easier to contact because the scapula is not in the way. Once you get towards the upper ribs, then your contact hand will be just a little narrow, but nothing changed. You just gotta make sure you're not going over the scapula, but you still can contact a good part of the rib there and just provide the oscillation techniques there. Okay? Any questions about this one?
Yeah, when would you do this technique? Like for what type of patient? Like pain?
Right,
in
you
the
find
back
they have
or?
like, pain with breathing, they're localized, they're pains at the thoracic spine, and you're doing your PA assessment with what's similar to what you're doing here. Is it painful? Then you go in there, like with any other joint arthropathy, you try to oscillate the joint, do a little bit, see if that changes or symptoms or not. And again, if you feel like the rib, sometimes you're gonna palpate the ribs, like we showed early on, like if, the palpation we did was more in the supine position. So if you try to assess the rib in prone, and sometimes you feel that one rib's a little more elevated than the other. When you like just rub your fingers back and forth, you try to assess for that space. But in prone, if you find that one rib is a little more elevated than the other, maybe that rib is stuck off position, and you can use the same technique to try to restore that actually position.
Dr. Larissa did that to me.
Did it?
Yeah, last semester, one of my rib heads was
Elevated.
posteriorly and elevated, and so he did that technique on me.
Yeah. Did you have difficulty breathing then or no?
When if I inhaled
He
a
would
lot,
stop you.
I could feel it where it was.
Yeah.
So and it kind of felt like a really big knot. Like it felt like when I was exercising and stuff, like it just felt like a knot.
Yeah. So yeah, you feel a little step there. Maybe it's a rib that